Hi, welcome back to our show. My name is Amy Decker, and I am Director of Client Services with Senior Helpers.
And I am Shane Silver. I am a seniors real estate specialist, and I am a caregiver.
And we are so thrilled that you are enjoying this journey with us. As you've probably noticed, is our format has changed.
Yes.
So we are now up close and personal, taking this on the road. And it's a lot of fun, but there's a big learning curve for us.
So please bear with us as we get used to the new format. And as we take you out into the community, meeting other people, meeting other professionals, seeing other communities out there,
Right.
Please bear with us, but we do hope to still share all of our knowledge.
Sure.
And all of our guest knowledge.
I give the same information. We thank the Carlisle for letting us host at their in their beautiful community. If you didn't see that, be sure to go back and look at the episodes for that. We also did the
Ann Norton Sculpture
Museum.
Garden.
And then we also did...
We were at Lisbeth Health Center at Wellington Bay. So you'll get to see a lot of great areas in our community and different assisted, independent, and memory care communities as well.
And so if you have a building or you have an office that you would like to offer us to be able to give you a little spotlight of who you are and where your location is, we can bring the interviews to you as well and have you be a part of it. So you can reach out to us on our Facebook page, on our Instagram page. You can send us an email to
seniorstrategies.pb@gmail.com.
Yes. And you can also call us.
You can call us
561-800-6654. We'd love to hear of a new place that you would like to offer our show to be on.
We're happy to bring our show that is now on the road to you.
And in May, we will have done this a full year, which is unbelievable that it's gone on this long. But it's been so much fun, and I think the guests that we've had and the information that we're offering to all of you is so important, because even with what you're dealing with right now, Shane,
you know, caregiving is a journey, and there's a huge learning curve that goes along with that. And we've said from the beginning that our goal on this show is to really be a resource and to connect you with resources sometimes that you don't even know you need. And I'm actually really excited about today's show and to have Kathy with us because I'm in a transition personally right now with my own parents, who I talk about quite often. My mother is thriving for the last 9 years with Alzheimer's, and my father has physical aging complications. And
isn't thriving as well.
Is not thriving as well. And we are in a situation now where 7 years ago, they were moved into an independent living community. About 3 years ago, we had to transition them into assisted. And now we are going through some evaluation process to see if I have to yet move them again. Unfortunately, my dad does need some additional care, and my mom is at the point where she may be ready for a full-fledged memory care community. So we're navigating that, and it's not just navigating those decisions, which unfortunately
are so difficult,
fall on me.
So difficult, yes.
To really do what's right by them and to make sure that they are getting the best care that they need.
Right.
But can I continue to keep them together? Do I have to separate them? And financially, what does that look like? Right. And that brings us into today's guest, Kathy, who's going to talk a little bit about Medicaid and Medicare and
the benefits you can get in caring for your loved ones, and how they help to navigate that. I think the biggest thing is you'll go, great, let's do it. We'll do Medicaid. Then you sit down and realize the process.
Exactly. It is a process.
Walk you through it.
And I would tell you, if you are thinking of navigating that process, please call Kathy, who you'll meet in a little bit. Call a professional who really knows how to take you through that process, because it's so important that you do it right. And also, if you currently have your loved one on Medicare or Medicaid, make sure you do a review of that policy, because and if they have long-term care insurance, because there's a lot of benefits in there that you may not be tapping into that could really help you as a caregiver and help your loved one. And there's so many people that never tap into that. You always say, oh, I want to save it.
I want to save it. I'm not ready yet. I want to wait till I'm really ready to start using it. This is not only good for your family or for your parents, it's also good for you to look at it. Like anything else, they say, look at your legal papers, look at what you have at least every 5 to 7 years, just to see, know what you have.
Whether you need to tap into those benefits now or later, know what benefits are available to you. You've paid into these insurance policies for so long. Use them. Use them. So we're excited about today's show.
We are.
We're excited to have you with us. So stay tuned and we'll be right back.
Welcome to Senior Strategies, Tools for the Caregiver with Amy Decker and Shane Silver. Join us on each show where you're going to enjoy a lively conversation that's going to connect you to the tools and resources that you'll need to coordinate care for the seniors in your life. We are so happy that you joined us. Kathy, we are so happy to have you on our show today. This is Kathy Kestler, and she is going to talk about Medicaid and more and how she took that business and then morphed it into something that's very helpful for our community and our seniors. So we're excited to have you.
Hi, yeah, thank you so much for having me today. I'm very excited about being here.
Thank you for joining us.
Yeah.
So I started my life in Texas. I'm from a small town in Texas, and I was very fortunate. I was raised with a very small family unit, and my grandmother was a matriarch of our family.
Aww.
And she was very involved with our family vacations, and I had lunch with her every day. And so I always grew up around seniors, and they always were involved and very important in our life, part of all of our holiday parties and events, and she'd cook for us. And so I grew up very fond of the elders. So I always knew that I was going to be in some kind of healthcare field, and of course I really went towards the senior population. So I became an occupational therapist, University of Texas in San Antonio. And I started my career at my first job at a rehab hospital in Las Vegas. And then from there, I worked in different nursing homes and home care companies. And I finally was able to rise to the regional position, and I ran 24 skilled nursing facilities.
Oh my gosh, what a
throughout
handful.
the state of throughout
24.
the United States. Yes.
Holy smokes.
Wow,
that was
a
a
lot.
full-time job and then some.
Oh yes.
Wow.
Then
And that was skilled nursing?
skilled nursing.
Oh wow. Okay.
I was a regional for the skilled nursing because I was the rehab directors for them.
Right.
And then I decided then I wanted to settle down here in the state of Florida. So I've been in one skilled nursing facility here in the state of Florida for 25 years.
Oh, wow.
So that's when I learned how to do care management. And I was moved into the social services and admission team. And we help clients to know how to navigate through Medicaid and how to be able to get resources and to move into skilled nursing.
And that's huge. I did it with my mother. Shane's done it with her family. I have to say, one of the most frustrating things is knowing that you need that service and having absolutely no clue where to begin to start navigating that.
One of the things I always tell people is navigating Medicare and Medicaid are two of the most complicated things anyone goes through on their caregiving journey, because it is so complicated. I give those of you who deal with it and know how to navigate it so many props, because I've been dealing with it for 8 years now and I still don't understand it.
And thank goodness for you that you can help
thank
people
goodness
with
that
that,
there are
because
people. Yep.
Yes. Thank you.
Yes.
It's true. So our healthcare field is so complex. There is not one resource that explains you how to navigate it. And so it's really just from experience and working in it that you know how best to manage it and to advise people on it. So then I started in 1999 the Medicaid and More, because I saw that other people besides just the one facility I was working in needed resources. And so that's what we do. We have a Medicaid specialist, and so we are a Medicaid application processing service. So we assist people with the application process.
So is that what the N more is?
And more.
Gotcha.
Yes, and because the more is the extra resources that we involve. So we do work with elder law attorneys that provides the legal strategy, and then we process the application and we oversee how the process should work. So we take people to the bank, we help them collect their paperwork, we'll help them to collect their Social Security income verifications, their pension letters, things that
everything that they need so that nothing falls through the cracks and it's a full application.
And I love that you have elder law attorneys that oversee this to make sure everything is done, because we've heard of other companies that don't use elder law attorneys. They just sort of do that on their own and kind of, so that's a great thing to know that you work with actual attorneys that can help you with that.
They the attorneys does the legal strategy, and we
Wonderful.
follow through with those strategies. We're not attorneys, so we can't provide
Right.
legal advice.
Mm-hmm.
And but we also are very hands-on. So we have more of a care management aspect to the Medicaid application that maybe an attorney would not have that personnel to be able to run to the bank or talk to financial people and say, the attorney said this.
Right. And I'm telling you, they don't. I worked for elder law for about 6 years, and they don't. They don't have it.
They don't have the time.
So they have to depend on you to be able to do that.
That's a great partnership. Great partnership.
It is.
It makes sense.
That's right. So it's a good marriage for both of us to work together to do the legal advice and the hands-on feel. And so then we do the Medicaid applications. We're at a 100% Medicaid application approval rate, which is amazing.
That's
awesome.
amazing.
Been in business for 5 years, so we get everyone approved. And there's a flat fee, and if we have to go to a hearing or we have to reapply, there's no extra fees. We just do what needs to be done.
Wonderful.
So it's a one-time flat fee, and we're with them until they're approved, which is also unique. The other places don't necessarily run that way.
And how long does that take normally for a normal approval process?
To go
3
through the
months.
process.
3 months. Okay.
Typically
But you've had
3
some that
months.
have gone longer, some that have gone shorter.
Yes, sometimes longer. But we are able to get them all the way back in most instances. And if not, then we have we work with the legal team to make sure we can get as much covered as possible. So.
Great.
So sometimes if, the family wasn't able to fund a qualified income trust, then of course they would miss out on that month.
Right.
So it takes a whole team approach. We all have to work together.
We always talk about our circle of care, right?
Mhm.
Making sure you have all the people in place that you need to make sure that all the care gets taken.
Including the family.
Right.
Absolutely.
Mostly the family.
Absolutely.
So then what we found is while we were doing the Medicaid and more process, came across several clients that didn't have family, or their family wasn't here locally, and they weren't able to help with the process. So in that case, the client, who was alert and oriented and said that they needed help, would then ask us to be their care managers, and or even myself as being their power of attorney as well. So that means I would be able to go collect the bank statements from them.
Nice.
And call the pensions and get those kind of information for them.
Right.
And so we ended up with this surplus of patients that needed ongoing bill pay. We have to go shopping, manage their life.
Doctor's appointments.
And so therefore we decided that we were going to transition our care management clients into Royal Care Management.
Nice. That's wonderful.
A natural progression.
Right.
Yep.
And the name of the company again is?
Royal Care Management.
Okay.
And so I'm certified, nationally board certified as a geriatric care manager. So I have a certified care management licensure. So we make sure we do care plans. We meet with our care managers. We see all of our clients at least weekly, if necessary, more or less, whatever they need. We make sure that our care is given on an individualized basis, so the client directs us on what they need.
Because everybody's so different. Their needs are so different.
And we want to make sure that they're always the center, the focus of our care management, and that we do what they want us to do. So we would make sure we don't instill our beliefs on them, that we follow through with what they want us to do.
What their wishes are.
So we always make sure everyone has a power of attorney, a healthcare surrogate in place. If it's not our team, but someone is out there that has the ability to support them. And
it's sad because I think there's a lot of seniors out there. I know even when we go into care for seniors, and we'll say, do you have somebody that can make decisions for you, both financially, and a lot of them are go, I don't have any family. I mean, I might have a neighbor, and it's so sad that a lot of people don't have anybody.
And sometimes they do have, what we see a lot when we're dealing on the real estate side is they might have that person, but a lot of times they're not local. They're not here. So they can't go to a doctor's appointment with them and really hear what the doctor is saying and know how to help them make those decisions. Or, it's a lot of times, especially being down here in Florida, we're so transient. A lot of the power of attorneys or the people that would be their kind of care manager are not local.
That's right.
So thank goodness you have that ability to do that too.
So if their families are away, then we make sure that we're the ones going to the doctor's appointments. We're sharing that information with the family, providing regular updates. All of our clients that go into the hospital, we make sure there's always a sitter with them so that they're protected while they're there. because being in a hospital is much different than being in a skilled nursing or assisted
Sure.
living facility,
Right.
and they need that extra support there.
Extra set of eyes
Just
and
want
ears.
to back up for 1 second too, because you mentioned that you were licensed as a care manager,
Yes.
right? So it's a licensure. And that's something we've talked about a lot, especially when it comes to legal documents.
Mhm.
We talk about not going online to get your legal documents,
Go
that
to
you
the
really should go
professional.
to a professional.
Mhm.
And I just wanted to reiterate that there is licensure out there for care managers, because there could be a lot of people that you come upon that say they're a care manager or act in that kind of capacity. But again, it is important to go to a professional.
Mhm.
Yes,
I think that's
you're
important.
so right.
Mhm.
The other good thing too is that if they do have assets that need protected so we can get them Medicaid, then we would help them to move those funds to an elder law attorney's not-for-profit account.
Mhm.
So then you have someone else to watch over the funds,
Right.
to make sure that things are done properly.
Mhm.
Right.
There's no one's being taken advantage of.
Right.
So
In the world that we live in today, I think seniors are such a target for scams. And we have a show that's going to be coming up actually in a couple of months that the whole focus is everyone's out to get them, whether it's through a phone call. This is your bank. You need to wire us money. Or
Right.
So to know that it's so sad that we have to cover all of our bases because
Make sure
our
that
seniors really are a target for that.
They
they
are.
are
Mhm.
high risk. I have a client currently right now in a skilled nursing facility that she doesn't have any family here locally.
Sad.
She's from a foreign country and her family lives in a foreign country.
Mm.
So I've reached out to them. They're willing to let her move to the foreign country to back to home.
Right.
And so the facility called us to see if we could help with this process. During when I first started, the neighbors came and picked her up, took her to the bank 2 times, trying to gain access to her funds.
Wow. That's a
Only
concern.
we got involved just in time so that we could protect her funds.
And how is she cognitively?
She's alert and oriented.
She is. So she knew enough to not let them get access to
She
anything.
went with them to the bank, but she didn't understand that they were
no.
accessing the funds.
Right.
She just thought she wanted to go see what her bank was. So it was, and she needs the money so
Of
she can
course.
go home to her foreign country.
Mhm.
So we are helping her to pack her bags. We've contacted the family. They're willing to let her come. We're getting her passport. We're
Nice.
packing her up, and we're going to have someone fly to
The other
overseas
Wow.
With her.
to go home, which is what she's in her 90s. This was her dream, is to go back home for the rest of her life with her extended family.
So sweet.
So this is some of the things that we do, which is very gratifying.
Wow.
You know?
It is gratifying.
Yep.
And you're putting pieces together to make somebody have a better life, even if it's just for a few years. Her
Yep.
wishes are coming true.
That's right.
Yeah.
That's right.
Aw.
Yeah.
So that's your care management company. The name of
Yes.
that again is?
Royal Care Management.
And what if somebody wanted to contact you for Royal Care Management? What's the phone number?
Our phone number is 561-919-9740. And my email is Kathy, Kathy, at royalcareforyou.com. Kathy at royalcareforyou.com. And we have a webpage, royalcareforyou.com. It's our web.
Good. And then if somebody is now wanting to apply for Medicaid and get the benefits from that, and they're hitting a brick wall, how would they get in contact with you?
Our main line is 561-809-9575. Again, it's 561-809-9575. It's called Medicaid and More. My email is Kathy, Kathy, at medicaidandmore.com. And we have a fantastic webpage at medicaidandmore.com, which tells you all about the cost of nursing home care, assisted living facility care, the Medicaid income and asset limits, and has lots of resources as well if you're looking for care management or you're looking for private duty or placements in assisted nursing homes.
That's
I want to
wonderful.
say too, when it comes to Medicaid, as we said before, it's very hard to navigate,
Mhm.
but there's a lot of myths out there with Medicaid. I think a lot of people say, oh, I heard there's a 5-year look back period or a 3-year look back period, or I can't do this, or I
I
can't
gotta
do
spend
that.
down, or I gotta gift my
Right.
money to all my kids.
Exactly.
And,
There's so many myths out there. And this goes back again to why a professional is so important. Having worked in it for so long, studied it, really being knowledgeable in it. And everyone's case is different.
Right.
Every scenario is
Mhm.
different, which is why I think it's so important to work with someone who really knows what they're doing, and to have that kind of, again, circle of care with the attorney involved.
Yes.
Everyone's case is different, and what worked for me and my parents may not work for you and your
Mhm.
parents,
Mhm.
right? It's all different. And I would say, don't get your information in the wrong place. Really
Right.
be careful where you go and who you talk to.
Or on Google. I get lots of calls saying, I Googled this and it says, and they get
Oh.
really upset.
Mm-hmm.
And
once they start the process on that, it's probably hard to retrieve it back. Or can that happen? So if somebody gets online and they start the application on their own and it is just crumbling, are you able to kind of pick up the pieces and then make it happen?
Sure, we can.
Oh, that's good.
We can.
What's the biggest challenge you think that you have faced as far as just getting somebody to come in and applying for Medicaid?
Every case is unique and different,
Right.
and so like you just said, that we are able to use our resources.
Mhm.
So I work with social security attorneys.
Oh,
I work with Medicaid attorneys, probate attorneys, estate law. So if we help them to get to the right
Place.
navigation, to the
right
right
person.
person, to make sure that they have the right information.
so there's no brick wall with you. You hit a brick wall here, then you get to that attorney to make it happen. If something happens
That's
there,
right.
you've got the professional.
we work
That's
with
great.
the resources.
That's great.
Yeah,
I always
for
call that our bag of tricks, right? She's
Yeah.
got a bag of tricks. Depending on what a client needs, she can reach out and say, oh, you need this
Right,
person.
right.
You need this
Exactly.
person.
That's
Right.
Right?
That's so true.
Yeah.
But I think what I guess the biggest issue is that whenever we have multiple families involved, so I may start with the wife,
Mm-hmm.
and then next thing I have the daughter,
Mhm.
which is usually fine, and then I get stepchildren and
Oh, right.
calling here, and then
Right.
brothers that are attorneys here, and so
And they all have different opinions
They
and
do.
different thoughts
Mhm.
and different, yeah.
they do.
Oh, yeah.
So
Mhm.
we on top of doing the Medicaid, we're kind of like counselors,
Right.
and also
The family
family dynamics, and so people are going through divorces or
Mhm.
second families. That makes it really
Oh,
more challenging,
sure.
Right.
because we want to make sure that our focus is always the client, the
Mhm.
applicant, the person in the facility that needs
Right.
the benefit, and you have all this other
Mhm.
stuff going on.
Right.
We have to make sure we want to do whatever it takes to make sure this client is protected.
Right, and
And
that's
they
the
get
biggest thing is
approved.
to focus on that one person because we find the same thing.
You deal with that
All the
Right.
time, all the time. You've got the client who's pretty amicable
Yes.
and pretty okay with what,
Right.
Right.
and then you have second families and their children, and then the ex-spouses of that one, and then the next door neighbor that thought that she was special to this.
Right.
Yes.
So it's tough, and you do become a social worker or a counselor
Family
because you got to get them
counselor.
all together and say, guys,
Wow.
we have to focus on what's most important here.
Right.
So
Yeah.
But the thing is when we can explain to the families that you're saving thousands and thousands, hundreds of thousands of dollars by going on Medicaid.
mhm.
So instead of paying $13,000 a month for a skilled nursing facility, you're only going to pay your income.
Mhm.
Whatever your income is, this is going to be the most you're going to pay.
Right.
And so we even can, if they're married, we can even lessen that they will have to pay. But that goes from like $13,000 to maybe $3,000 a month that
Wow.
they're paying
Right.
for the same service.
Right.
Mhm.
Right.
So once we explain that and the families understand that, it's such a huge savings that there's no way they cannot move forward with
Wow.
And I think too, working for elder law and then dealing with my mother too, when people hear the word Medicaid, they're thinking, oh, she's going to
Yes.
get a really yucky bed
it. Yes.
way in the back next to the janitor's closet because those are certain rooms that are going to be, but they're not.
You don't even know.
You don't know. The
No, it
person
is.
next to you, like you said, spending $14,000 and we paid almost nothing for
It
a
is
month.
so
Yes.
different today.
Yeah.
People have such ideas of what independent living, assisted living, skilled nursing, which is what we now call the nursing homes of back in the day.
Mhm.
Everyone has such ideas in their head of what they are. They are not today what they
They
were
used to
10
be.
years ago, 20
Right.
years ago, 30 years ago. They are so different.
Oh,
I think
we've gone
that's the biggest,
yes.
thing that for my clients, the hurdle they have to get past. A lot of times when we sit down with clients that are selling their home to go into one of these communities, they can't fathom how great most of these communities are.
There are some of them now that I feel like, how you can do like a prepaid planning with the funeral home and get your burial. I want to like set up a prepaid planning at one of these assisted livings that it's like walking into a resort. Can I just start making payments now? And I don't have a room when I'm ready to get in there. Because
They
they're
cook
beautiful.
for you, they clean for you, they do your laundry.
And it's a resort.
And
It looks
look,
like a resort.
I can go to arts and crafts, I can go to bingo,
Right.
I can go to happy hour, I
Right.
can do whatever I want. I can go on a bus trip. Yeah, I'm ready. Sign me up.
But the honest truth for most people is that everyone wants to be home.
Yeah, that's true.
You're only
true.
You only go when there is no other choice.
Right.
Because you need the care that you cannot receive or afford at home.
Right.
And so, that's most everyone wants to be home if possible, for as long as possible. And we try to do that as well because Medicaid does cover care in the house, about 20 hours a week for Medicaid. And if they have any funds, they can supplement that as well with additional staff in the house.
Right.
And then
with senior helpers.
Yes.
That's why I'm pointing to you. And then, of course, in an assisted living facility, it would cover about $1,700 for the level of care in an assisted living facility. And then the client has to pay the rest out of the pocket, which depends on how fancy they go.
Right.
But you can get a nice one for about $3,500 plus the level of care, the $1,700. And then, of course, the skilled nursing is the 24-hour care.
Right.
Where then at that point, you just pay your gross income less $160 to pay for your care, and everything's covered for you there.
Right.
That's great.
So you're there because you need it.
Right.
So.
And it's hard. I think we've talked about this too. Is when you have to have that conversation with your parent that it's time to go to an assisted living or a skilled nursing and we've had at our caregiver burnout group where a gentleman said, I paid so much money to keep my wife at home for 3 years with round the clock care and realized she really did better once she went into a memory care.
Yes.
Because she had things to do and people to
Yes.
Instead of just having a caregiver there that's, taking care of her personal needs, go into these. It's better for them sometimes.
And we've had discussions too. In our last episode, we talked about the differences between independent and assisted and memory care and
skilled and
skilled and how you make that determination what someone really needs, what level of care they really need, and when is it time to move. That's what we're doing now. My parents started in independent. Now they've been in assisted the last almost 3 years. And now my dad may need more care. So how do we determine, does he need to go into a skilled nursing? Is my mom ready for a true memory care? Those.
And then how do you pay for it?
Those decisions are hard. And then how
to get the funds to pay for these to get in there. And that's when you can kick in and say, I'll help you.
So I will be calling you after the show because we will need to chat. But yes, these are all really difficult decisions and really difficult to navigate. Not just I have to consider what do my parents want, but also what's affordable.
Right.
What's affordable and how does it get paid for?
That's right.
And how do we make the most of, a lot of people I think have benefits that they don't tap into.
They're afraid to. They're afraid to
for
whatever reason. We don't want
to
to spend them all right now. We want to wait till we really need them. Well, you're 93.
Right
now would be a good time to start using those benefits.
Yeah.
But they don't want to. They want to wait until it's,
and how does someone even, is that something you can do? Can you sit down with them and review, these are the benefits that are available to you?
Absolutely.
Because I feel like there might be some that I don't know about that maybe we need at this point.
Well, actually, I've had clients that had long-term care policies as well that had benefits for care management or private duty or equipment or specialized equipment.
Oh, nice.
And they
didn't know it.
And they had no idea.
And they passed away and they never tapped into any of those benefits.
No.
So, that you pay that policy and it's paid for. When you pass away, it's gone. It's not transferable.
Right.
The family doesn't get any of the money back. So they're amazing to have, but you need to know what's in your policy.
Right.
and use
So, note to self, if you do have a policy and you're not sure what's in that policy and you are looking to have some services covered, that would be a good idea to have a professional sit down with you.
And review what's
What's
benefits you
available
have.
while you can still use it
Yeah.
before you lose it. Mm-hmm.
absolutely.
Yeah. Well, we are so happy to have you.
Thank you.
I think you've really shared a lot with us. And again, we've got Medicaid and more, and we've got your care management company.
Give
Royal
us your
Care
phone
Management.
number one more time.
Sure. So Royal Care Management is 561-919-9740. We treat you like royalty. And our Medicaid and more is 561-809-9575 for Medicaid application processes. Thank you so much for having me today, ladies. I really appreciate it. If you have any questions, please feel free to reach out or call me.
Thank
And-
you so much for being here today.
And if you do have a question, our number that we can refer you over to Kathy is 561-800-6654. That'll be on our Facebook and our Instagram page, also
YouTube.
information on our YouTube channel. So, and we've also got our email address.
Which is seniorstrategies.pb@gmail.com. So you can reach out to us anyway. You can reach out to Kathy directly, or you can reach out to us, and we'd be happy to connect.
Yeah, and we may have questions. You may have questions now that you'd like to ask. So feel free to post those so we can pass those on to Kathy.
Thank you.
Thank you for joining us. Bye-bye.
Bye-bye.
Thank you for joining us today on Senior Strategies. We hope that you found the tools and the strategies that we offered you beneficial for your journey as a caregiver. We want you to leave today feeling empowered and supported.
Please follow us on Instagram, Facebook, and YouTube for upcoming shows and events. For more information, to schedule a consultation, or to join a support group, please contact us at 561-800-6654.
And remember the strategies
And tools you can use
to make your journey easier.